This one is more lifestyle, a couple questions. A big one, any energy drinks enhance brain function long term?
Well,
Or actually probably are good for you in general.
um,
Fight with our
sorry,
teenagers about this all the time.
sorry to disappoint, but energy drinks really do not have a positive impact on the brain, short or long term.
Hmm.
They they're I can only think of negatives associated with energy drinks.
We're not looking for any sponsors here.
But yeah, sorry, killed my potential for sponsorships. Hey guys, welcome to the YouTube channel of the Stroke and Brain Aneurysm Center of Long Island, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
All right, so you guys loved the session we had on
Mythbusters.
Mythbusters, right? And I was trying to think of that word. And we're thinking, we'll do another one. And so we asked for you guys to send us several things that you hear are true, and maybe you read online they're true, or on social media, and then we will confirm or refute them. So I'm going to pass it off to Jason, who's going to go through them real fast, and I will be here to confirm or deny.
Yeah, a lot of positive feedback from that last episode. People like the down and dirty, just getting to the nitty gritty of it. So our first one, and this comes back to even some people in the office, that imaging scans, CTs, and MRIs can diagnose all the neurological conditions that we see or treat.
Right. So of course that's not true. We patients often have the expectation that if they have some symptoms, headache, nausea, dizziness, whatever have you, neurologic, even weakness, numbness, things of that nature, there should always be a finding on a CAT scan. There should always be a finding on an MRI. That is definitely not true. The imaging modalities that involve an MRI or a CT scan are really looking at anatomy. They're looking at the form of the brain. They're not really looking at the function of the brain. And as such, there's a lot of other tests that you can do to look at the function. And sometimes you can have very profound symptoms with absolutely negative imaging. And in those cases, we just need to look into things further from a different perspective and look more into the function of the brain and the function of the nerves.
Nice. This one's a common myth because we get calls, people trying to schedule. Neurosurgeons and neurologists do the same job. Don't take offense.
No, not
Schooling's a little bit different. I know that.
It's just two different specialties, right? And I often see patients in the office, and they when I explain to them that they need to see a neurologist, they'll say, "Well, what are you?" And there's a little bit of a difference. So a neurologist is the medical doctor that deals with the brain and the nerves, and a neurosurgeon is a surgeon who operates on the brain and the nerves. So just to kind of make it a little bit simpler, a neurologist uses medications to treat problems in the brain, and a neurosurgeon uses surgery, either minimally invasive or open surgery, to treat these conditions in the brain, the spine, and the peripheral nervous system. So that's the basic difference between the two.
So this happens a lot, that people believe that they can't prevent a stroke, that it's going to happen. It's just for multiple reasons out of their hands.
That they cannot, correct?
They cannot.
Yeah, so that's not true. About 80% of strokes are the result of modifiable risk factors that you can change. Big ones are high blood pressure, cholesterol, diabetes, or smoking. Those are the big ones, and those you can modify. And then, of course, it's about 20% that you cannot really do much about. So I always say that the day that, you guys put us out of business by controlling 80% of these risk factors would be a good day. But certainly, you can make a difference in your stroke prevention risk.
And this one, we do our education, and we talk about the signs and symptoms of all our diseases.
Mm-hmm.
But truth be told, one of the questions is aneurysms always show warning signs before they rupture?
Actually, the truth is exactly the opposite. So brain aneurysms, unfortunately, brain aneurysms, they are also called by some, and I don't necessarily love that term, but they're called the silent killer, right?
Mm-hmm.
And the reason they're called the silent killer is because they generally present without any warning signs or symptoms, and they just come on when they rupture with a horrible headache, worst headache of somebody's life, 0 to 100 in a split second. And after that, a lot of patients will die. Some will make it to the hospital with severe deficits. And so it's a challenging problem. So most of the times you'll have 0 warning signs. And a lot of folks live out there with an unruptured brain aneurysm, which, of course, depending on its size and morphology, might or might not need treatment. But at the end of the day, most of the times you're not going to get a warning for an impending brain aneurysm rupture. If you do get one, most of the times it would be in the form of a bad headache that might precipitate or prompt a scan, or an issue with the nerve that controls the eye, for example. You can get a little double vision, but all these coupled with a brain aneurysm might necessitate action.
Mm-hmm. Another one, and this one kind of comes from a lot of the patients who've had stroke that are in the middle of recovery. Maybe it's a long journey. Brain damage is always permanent.
Yes and no, right? So the tissue of the brain that is involved in damage, it never really recovers in adults. It's the cells you have, and there is some evidence in recent years that there might be actually cells that might still replicate in the brain even in adults, but talking in general terms, what's gone is gone in terms of tissue. Now, brain function, or neurologic function rather, might very well recover given enough time and given enough therapy. And the reason for that is that we have what's called neuroplasticity, and the brain is able, or the spinal cord is able, to utilize other areas to perform the functions that are lost, and the cells that are lost. So at the end of the day, there's still a substantial possibility, and of course consult with your doctor in every individual case, but there's a substantial possibility for improvement, which is majority of it is in the first 6 months to a year. There's always a possibility for improvement, but it gets less and less over time. And really, you can maximize that chance by engaging actively and aggressively in physical therapy, occupational therapy, and speech therapy.
Mm-hmm. Neurosurgery is always a last resort.
Do you think that's in regards to maybe spine surgery or brain surgery?
Well, I think patients think that neurosurgery, when you hear like cardiac surgery, it's these big specialties that are overhanging, and it's oh my God, I'm having brain surgery, I'm having open heart surgery. I don't think they realize the minimally invasive treatments and stuff like that.
Yeah. So there's some situations where you can do neurosurgery as a first line of treatment, that you don't have to go into medical management, and that depends on symptoms. It depends on severity of the neurological problem, but certainly neurosurgery has evolved to from the time of big operations where you have to open the brain and open the spine, to minimally invasive operations where you can do things through a blood vessel without opening the head, in a situation where you can stay in the hospital for a few hours and go home. And so certainly we've evolved to the demands of society and the request for less and less invasive procedures.
Mm-hmm. We talked about this a little bit with one of our recent guests, but how pain is always in the body and not in the brain.
Oh, yes. And you hear that a lot, mind over matter, right?
Yes.
And so when it comes to pain, and of course pain is a very complex problem, very large discussion. We barely scratched the surface with our guest, Dr. Finet. But in reality, pain is a complex interpretation of a stimulus from the outside world, and that interpretation happens in the brain. So really, pain technically is always cerebral. And so there's no necessarily separation. Now, that being said, there's ways to trick the brain, like Dr. Finet was explaining, and despite the fact that normally you should have a pain response to a stimulus, you might not, but that's just part of tricking the brain and using other pathways to silence the response that would normally be interpreted as pain.
This one is more lifestyle. A couple questions. A big one: any energy drinks enhance brain function long term,
Well,
or actually probably are good for you in general.
um,
Fight with our
sort
teenagers about this all the time.
sorry to disappoint, but energy drinks really do not have a positive impact on the brain, short or long term. They're I can only think of negatives associated with energy drinks.
We're not looking for any sponsors here.
But yeah, sorry, killed my potential for sponsorships. But there's only negatives associated with energy drinks. When it comes to the brain, there is zero possibility of energy drinks having any positive impact, short or long term. If anything, they would cause your thoughts to be discombobulated, and they wouldn't allow for high level function, unless you're dependent on them. At which point they probably are adequate for you to function. But in all actuality, not a great idea.
Yeah. The brain shuts off when you sleep.
Exactly the opposite. So the brain is extremely active when we sleep. And actually, I think we've discussed that in a previous podcast or video. The time we learn is when we sleep. So during the day, we get a lot of input, right? Input that's consciously perceived by our body when, we have this conversation. So consciously, I know that we had this conversation. Or unconsciously, for example, the color of the wall behind you or the lights in this studio that I'm seeing, but I'm not really consciously processing. Of course, now I did consciously process them because I discussed them with you. But if I wasn't, and so the brain at night will decide what of those stimuli it will perceive as useful and store, and what it will delete as irrelevant. And obviously the unconscious stuff, most of it will be deleted as irrelevant. The conscious things will remain. And so the brain is tremendously active, especially if you're in school. Sleeping is the time you're learning. So for kids that have disrupted sleep patterns, or they study late into at night, and they anticipate they'll be performing well, that is a complete recipe for disaster. You cannot do that. You're not learning. If you're not sleeping a lot at night, at least 6 to 8 hours, and I would err on the side of more, especially for younger kids, I would say you're definitely not learning. You're definitely not allowing the brain to process and create and grow and create new connections, and help you process and cope with life. So our brain never shuts off until the day we die, and as a matter of fact, it's extremely active when we sleep. And the time a lot of this sorting out of memories happens is during our REM sleep, the rapid eye movement part of sleep, where our consciousness is semi-on, and we're able to have dreams, because as the brain is processing these memories and there's different free associations happening, we can have these dreams that are the result of some experience or some input during the day. That's, of course, in our brain as the memories are being stored, it's being interpreted in a weird way. That's why dreams are also discombobulated sometimes. Some are very crisp and clear, some are more messy, but that's a very, very big conversation. And I think to some extent we should engage a sleep specialist and bring him for a podcast. I think people would love that.
For sure. I mean, because we've talked about it a couple of times,
Yeah.
very lightly.
Yeah, let's do that.
But it's very it's a big topic.
Yeah.
Especially with everybody having these screen time issues late into the night.
Oh yeah, yeah.
And or like you said, a lot of younger kids think that they don't need to sleep, or
Yeah.
they want to do other things. People have it's almost, there's a common trend now that happens, is that people force themselves to stay up late doing stuff that they want to do because they're trying to take back time from the day that they lost doing stuff they didn't want to do.
That's right. Don't do that.
Exactly.
Don't do that. Let's get a sleep specialist here. Next.
All right. Thunderstorms and the weather do not affect brain health.
I wish I could tell you that definitively I know the answer to that. I don't know that we know that definitively.
Now we got to get a meteorologist here.
No, but of course, we do believe that barometric pressure and changes in weather have an impact on mood, of course, they have an impact. They have an impact on migraines.
Mm-hmm.
They have an impact on pain if you've had surgery in the brain or elsewhere in your spine,
Joints.
joints. So they definitely have an impact on the body. Now, do they affect brain health, brain function? Tough to measure, honestly. And we don't have a definitive answer. We don't even have a definitive answer, when it comes to brain aneurysms, which is what we do every day. If they affect it or not, we think they do, but no study has been definitive. So we'll put an asterisk on that, and when we have more information in the future with more studies, we can talk about it.
Gotcha. And our last myth for the day, kids recover from brain injuries better than adults.
That's another tough one. So we do believe and we do see that the younger you are, the higher the chance to recover motor function and speech function that's been lost as a result of a stroke or a brain injury. And the reason for that is that, of course, the brain has a lot more plasticity, is able to respond to injury more. Now, we don't really have good understanding of executive function and kind of how a kid that's fully recovered or substantially recovered their motor and speech function is able to recover that aspect. And often with kids, of course, they might have an injury, they might recover well from it in terms of the brain, and then you never really know the prolonged or the long-term impact of that injury until, of course, the kid's substantially older. So I would say generally yes for things that we can measure. For things that we cannot well measure, it's tough to assess. But yeah.
Gotcha. All right. Well, that sums up for today. Not that we're not going to do this again. So
excellent. Well, thank you guys for watching. We'll catch you again in another video. Don't forget to like and subscribe, and see you soon. Take care.